All right, what it do, guys? My name is Gauta, but people call me Dr. Khomu. I'm at Polosong. I'm a second-year medical intern at Polosong Hospital. So my story is that I didn't actually choose Polosong. Polosong chose me, which is the story for most interns that are there. Shout out to all the interns at Polo. Yeah. So essentially, I didn't get a place where I wanted, and then I had to swap, and then Polosong was the next best thing. And then in actual fact, it actually was the next best thing. So essentially, as you can see here on the map, Polosong is in Tsakane, Brakpan area, and that's like east rand of Joburg. I currently live in Boksburg, which is about a 30-minute drive away. And then the nice stuff, like where the things happen, is also 30 minutes away from me. So I'm kind of smack dab in the middle. I've got a video of some drone shots of the actual hospital. So this is our hashtag for all the interns that are there. Riba Pulusi, which basically means, so Polosong means savior. Yeah, if I'm not mistaken. So Riba Pulusi means we are saviors. So as you can see, it's a district level hospital. It's got all the departments you need, excluding psych. We kind of just combine that with internal medicine. We also have ophthalm, and we also have ENT here, and you can do your ComServe here as well. So as you can see here at the back, this is the DQ, and this is how big the hospital is. It's all one floor, some parking. There's politics around parking, but I'm not going to get into politics. That's the main entrance. We've got a casualty there. So essentially, we've got 600 bed capacity, plus minus, give or take, with about plus minus 40 interns. So we actually got a lot more interns, and this is sort of the area around Polosong that there's more behind there as well. So we actually got 40 interns when I started. They had a lot less before we got there. So just moving on to the next slides. So like I said, I've done all the rotations except surgery, so I'm just going to comment on those. So in terms of departments, casualty, I've done that. And the funniest story, when I was 2 weeks into being a doctor, so just fresh out of varsity, just fresh out of graduation, I was on call, and then one of the MOs, she was a locum, so she was like, I gotta go. And I'm like, girl, I don't pay salary, so you can leave. But as she left, a patient comes into the stretcher, and they were like, Dogotela, resus. And I was like, what? They're like, resus. I'm like, who are you talking to? So then, yeah, this was 2 weeks in, guys. Like, I had no experience whatsoever. But I got there, and the nurses actually, they just ran everything. They were like, Doc, should we get you a blood gas for ABG? I was like, good idea. Let's do that. They'd be like, do you want stats monitor? I'm like, let's do that. But essentially, it was like a sink or swim moment. It's a funnier story. Slide them DMs if you want to know. It's just for time purposes. Yeah, so that's the funniest story I have for casualty. And then there's also Obs and Gynae here. Obs and Gynae was a vibe. Like I'm actually enjoying my internship here at Polosong. It was actually like a diamond in the rough kind of hospital. And the main reason is that the interns that are there actually make it worthwhile. Because the intern culture that's there is very supportive. It's very fun, and everybody's like-minded and all of that stuff. Obs and Gynae was really great because so at the moment, Polosong is undergoing transition. So there's like a lot of new consultants coming in, a lot of new staff coming in, like they're renovating the whole hospital. So it's actually on the up and up. So I just caught it on the first up. So Obs and Gynae was really nice. You get to cut your own Caesars. You can be as involved as you want. I got like 20 Caesars done. At some point, we had an intern-led Caesar. So the one intern in anesthetics gave the spinal. Myself and Fortuna, we actually cut the Caesar together. Obviously, the MO was like scrubbed in and ready to tackle anything at hand. But like you get a lot of experience and a lot of exposure. We got a new CT scan. This is actually like gold when it comes to Gauteng Department of Health, and I'll talk about it in a while. I also did ortho and anesthetics. This was me in orthos because as a UCT grad, like, guys, it's, yeah. Everybody will just know, like, UCT grads with ortho, it just doesn't mix. So that was me during ortho. Anesthetics was really nice, great exposure. The consultants there are really awesome, very academic. What else did I do? I did peds, best consultant ever. She was amazing, really supportive, really great. And the nice thing about being in Pulasong is that all of the consultants, if not most of them, are people of color. And it's just really great coming, especially from the Western Cape and UCT. It's really great to just be like, ATA to your consultant. Like, they're actually on that level. You can slide DMs, even if you're done with the rotation, you can actually call them up and say, dude, I've got this problem. Like, I remember calling my anesthetic consultant while I was in peds, and she gave me like the whole breakdown of what I should give, what I should monitor for, because we had to intubate and stuff. And then the other rotation that I did was, I'm currently in internal medicine. I am loving it. Best place to be in COVID, because that's where we expect COVID. So that's where we're most careful. In terms of resources, Gauteng is the ghetto, straight up. Coming from the Western Cape, I was talking about, those safety Jalco needle things? Yeah, nobody knew about that. And I was like, Gauteng is just poorly run. And the amount of politics that I've seen and I've been involved in, it'll boggle the mind. But you do with what you have. So it's not like completely the worst. You just don't have a sharps container for each bed. You just have a sharps container for like 2 wards or whatever. It's not that bad, but it's definitely a mind shift when you're coming from UCT and Western Cape Healthcare. We just recently got our own CT scanner, which makes like waiting times a lot better, but there's still issues around that. Number of interns, we do have 40 plus interns. The interns are just absolutely amazing. It's like the best intern team I could ask for. And if I had to choose Pulasong again, I would only choose it if the same interns were there. So there's 40 of us, and we're spread around sort of where we're needed. With the second years, with the new first years coming in, because rotations have changed, people usually stay together. Whereas with us, we were allowed to choose which rotation we wanted to do next, because it really didn't matter. So you could like adjust your life accordingly. They'd obviously put you in a rotation, and if you have a request, you can put it in and say like, can I do this? For example, I wanted to do surgery last because, the number of calls you get are roughly like 4 or 5 calls in a month, because there's actually a lot of us. And the calls aren't that bad, depending obviously in whatever department you get. We set up our own roster. We talk before, we talk about leave. And then you basically have a lot of control over your outside life. In terms of leave days, you are allowed a maximum of 10 for each rotation. You obviously can't get that because you only have 22 days a year, but you can take 10 days off, and you like mix it with your, holidays and stuff. So you could get 2 weeks off. I think I got 2 weeks for most of my rotations. I'm currently on leave now for internal. So leave days very much in control. The drive there, like I showed you, all against traffic. If you're living in Boksburg, for me, it's all against traffic. There's literally nothing between here and there, like not even cows, like even venture this side. So the traffic is not bad. If you want to live, I know some people who actually live a bit further away. The traffic probably take you like an extra 20 minutes to get to work. But if you're living in Gauteng, traffic is just your life. So you can't really get away from that. The hospital culture, split into 2: management culture, which is absolute, questionable. And then there's internship culture, like intern culture. And like, basically the culture here is that we are here together. We're going to get through this together, even though it's like the worst situation ever, at least we're together. Like, I really like the team I'm with. They're really great. In terms of like actual work stuff, you literally, if you need help, you call one of your friends or one of the interns. They don't have to be your friends yet, but you can call them and ask for help. In terms of like if you're working in the same department, I know I call like on my friends to actually help me do my bloods and do this and do that, so we can all leave early, even though they're not in the same ward. The other help that you get is that a lot of us obviously rotate in different departments. So if I don't know anything about peds or I forgot something, I actually call up whoever's in peds or whoever's done peds. So there's a lot of camaraderie around there. And there's also like a lot of respect because we actually see each other as doctors and not just interns. So we actually consult each other. And I'll tell you why in a bit, because the MO story is a bit shambolic. DQ, I don't live in DQ. It's very pink. I can't really comment. I heard there were cockroaches once. I don't know. I can't really comment. But it's a roof over your head if you need a room. Some people actually rent the DQ with their separate houses because sometimes like the calls get a bit long and you don't want to drive. So you actually have a place to stay. And you can like zhuzh it up if you want, because the doctor's quarters where you sleep for your on-call room, yeah, it's not the best. But like I said, they're renovating stuff. I don't know if they'll get there, but yeah, that's a story for another. Classroom. This is an initiative I got involved in when I first started at Pulosong, and it's basically like taking healthcare to the community. So what we do is that we go out as young doctors and we go to schools and talk to the young guys about like safe sex, drug abuse, depression and anxiety, because these are some of the topics that are well known in the community, but not necessarily spoken about. So it's much easier if you can relate to someone your age or semi around that age. And it's been like a rousing success, actually. Follow us on Twitter. Our hospital also has a Twitter account, so you can actually follow that to get a bit more information about that. I already went through this. So this is PEDS. It was really great. This is some of the students that we visit when we go for Doctor in My Classroom. This is some of the interns here. That's Dr. Lef. Shout out to my boy. But like I said, so where is she? Below. She organized donuts for us during the lockdown because like we just needed. So I've organized some hand sanitizers for us because DGM was a commodity when lockdown came through. So there's like a lot of camaraderie. Like we really support each other. So it's really great. And then this is us in the Doctor in My Classroom. Shout out to my boy Hoskins and my girl Maseko, Bandile Masuku, the MEC. So I've spoken about a bit, I'm just going to rush now. I've spoken a bit about the hospital life. The actual life that you actually would love is what you can do outside of the hospital. So everything you do is like Joburg, Sandton vibes. If you've got the time or friends, you can even go to Pretoria, but that's a bit far. So I do pub quiz. Well, I used to before the lockdown. Every Wednesday, it's like really nice, great time to like learn some stuff, hang out with friends. Because obviously some of my friends are working in Joburg as well. The nightlife is where it's at in terms of Joburg. Clubs, pubs, bars, like the nightlife it's nice. Maboneng Precinct can also be like an evening nightlife. Like it's quite nice, sort of like your little pocket away from the chaos of Joburg. Gauteng is really not for the outdoors person. It's more for like food, drinks kind of person, like sort of indoor activity kind of stuff. The food and drink scene is actually quite lit. Like slide them DMs. I've got a whole Excel sheet about where to eat and where to drink. It's absolutely lovely. Outdoors, there are a few places, but you have to drive a bit out. Yeah, that's all I can say. Can't really say much about that. Safety, dude, it's Joburg. Like safety is always an issue. Compared to Cape Town. But Joburg, if you have your wits about you, don't obviously do dumb shit, but also have everything insured, you'll be fine. It's actually relatively safe depending on where you are. I'm staying in Boksburg now. It's like absolutely quiet. But you just have to have your wits about you in general. Cost of living is like the one upside that I've realized staying in Joburg. The food, the apartments, like everything is so much cheaper. The only thing is petrol. It's a bit pricey here inland, but everything else is so much cheaper that you can actually save a lot of money. So if you consider not even just Poloso coming to Joburg, these are some of the pros and cons. I do have a pros and cons list, but just because of time, people can just slide DMs. And then this is, yeah, so basically, like for me, in terms of internship, it's a balance between working hard as well as playing hard. Like, guys, you're gonna earn cash dollar, spend it. Like, it's your money, you've worked hard, spend it. So right at the end, I've got some survival tips that I've gone through internship, and that's why it's been so great. Number one is put yourself first, always. Like always put yourself first. If somebody says, no, go do this chest drain without this, say, no, get off, just like shut the fuck up. Sorry for my language. Like, just get away from me. If people say, we're on call together, there's 2 MOs on call, but you're the only intern, and then people start splitting calls and you're working 24 hours, you say, it's my time to sleep, I'm gonna sleep. If people be asking you, oh, who's gonna cut this? You say, not my problem, it's my time to rest. You have to always put yourself first, especially even now during COVID. Our consultant at internal medicine is like, no PPE, no work. Basically, if you don't protect yourself, then you cannot do anything. So always put yourself first. And like, don't be afraid to have big balls and big ovaries, guys. Like, honestly, you're an adult now. People should start treating you like an adult. Don't let people exploit you. Also, you're not there to make friends. If the MO hates you, it's fine. As long as the patient is alive, like, it doesn't matter. That's my motto. Because at some point you will have friction with people, and you have to balance between your sanity, the patient's sanity, and the other person's sanity. All in all, your sanity matters. The second tip is that know when, and more importantly, who to call for help. So when you're here it's a bit peripheral, you have to take everything with a pinch of salt. Some MOs are really great, like they're really great to work with. Some MOs you can see like, yo, niggas be dodgy, like proper dodge. So know who to call for help. And like I said, rather call an intern if you're with a shit MO, and that's a fact. So sometimes just know when to call and who to call. So just because you're a doctor doesn't mean you have to know everything. The most dangerous doctor is not one who, what does it say? Who doesn't know anything, but the one who thinks they know everything. So just know your limitations. At the same time, also get your hands dirty. Like, if you're not really sure, like, what should I read? What should I do? Because obviously, like, you're coming from a student to a working sort of lifestyle. Rather learn the basics. Know how to shift potassium, know how to resusc, know your CPR, know what to do if somebody comes in with like an asthma attack. Just your basic things, regardless of what rotation you're in. Just like basic things that are going to help you, because any other thing is like, it's okay. Like, okay, hyperkalemia is like, okay, fine, we can wait to call the MO. But sometimes when a patient is crashing here and now, knowing your basics, chest compressions and bagging, that's all you need until somebody comes. So that was my thing. That's my whole casualty experience. Just know like the basics so that you don't freak out. The other tip is that EM guidance is the new Bible. That's a fact. The amount of times I've managed a patient, prescribed for a patient purely based on EM guidance, 100%. Definitely download that app right now. The other thing is that if you can't put your name or your client number at the bottom of every consultation that you have, then that's when you can tell yourself, I can do better. So I always say, like, I never mind telling the nurses, if you have problems, call me on 4170. That's my speed dial. Whenever I sign referrals, I always write my name in full, because I know that I've done a thorough job and I know I've done the best for my patient. It doesn't have to be like the best. It's the best at what we have. Like, if there's no CT scanners or whatever, it is what it is. But if you can put your name at the end of that and say, if anybody's going to call me, I can answer any question about this, then you know you've done well. And then the other thing is that spend your money. Like, first 3 months, I didn't save. My financial advisor said, you just graduated, you need some creature comforts. Like, if y'all see my house right now, creature comforts, spend that money. But obviously don't also get trapped. I got trapped in a credit card. It happens, guys, it happens. So for me, if you don't have somebody you know that's like an actual accounting boffin, or you yourself don't know finances, I would highly suggest a financial advisor. Know anything about money, like, guys, like I don't know this kind of money, like a first generation doctor in my family, like we don't know this kind of cash. So it's good to have somebody actually help you manage your stuff. So like right now, no credit card debt, no nothing, positive cash flow. It's really important. It's something that people don't actually realize. It's okay to ask questions about money. When you don't know, you don't know. And then at the end, learn as much as you can, because after each block, you're now an MO in that discipline. I said law because it kind of hit me the other day, because when you're done with PEDS, you won't get another time to do PEDS unless you are an MO in PEDS. But essentially, when people call you, for example, next year, when interns are going to be calling me, they'll be like, oh, what should I do? You should know. So if you want to gauge how well or how much you have done in a rotation, or even during the rotation, ask yourself, if I'm in Pitsonavatar, will I still be able to manage a PEDS case, a gynae case, an internal medicine case? If that answer is yes, then you're happy to just move on from that block, regardless of whether you like it or not. Because next year, when you become a comserve, well, speaking about myself, you're much more independent. So get those skills in internship, learn as much as you can, cut as much as you can. Obviously, if it's a rotation that's not really like working for you, that's okay. It is what it is. For example, orthos didn't work for me. Don't call me for bones. But yeah, so that's the end. Kind of went quick. Oops. Stop to share. Yeah, kind of went quick. And then, yeah, that's it. For me, like, Pulusong actually has been like a diamond in the rough. They'll ask me questions. That's my life.
No, he's not on anymore. You have to read the questions yourself.
Oh, I have to read the questions.
No, I'm back. I'm back. Escom
he's back.
Escom did turn the lights off here, so apologies for the,
Okay.
But I'm here. I can read these questions to you, although most of it was just commenting about you throwing shade at poor Lisa. But I think the first one here was from Clementine. Clementine, sorry if I'm saying your name wrong. They said, how's internal going?
Internal is absolutely amazing, but that's because I love it. I'm actually considering specializing in internal medicine. I've considered specializing in every rotation that I've been, because it's been so great, but I think I'm settling on internal. The consultant is absolutely amazing. The MOs, they are absolutely amazing. Like I said, Pulusong is on the up and up, so they're weeding out all these chronic MOs. They're really renovating the place up. Still politics to talk about, but like internal medicine, absolutely the best, especially during COVID. We're well protected, not overworked, well, as much as you cannot be overworked just because of numbers and people being sick. But it's absolutely brilliant. Yeah, I like
Cool.
it. We get a lot of teaching, and it's 10 to 15 patients. But if you want to do more, that's all up to you. Like, I see more patients because I want to learn. And then the consultant comes, and then they're super chilled. Like, the one consultant doesn't like surnames. He just wants names. He's like, what's your name? And I'm like, Dr. Kobe's like, nah, nigga, your name. And call me by my name. So they're super cool, lots of teaching, and like they're very academic, like hella academic. So internal medicine, really dope.
The next question was from Tiro. They said, what was your first option for internship, and where did you eventually swap from?
So my first option was Kalafong in Pretoria, which is a secondary becoming tertiary kind of stuff, which is what's happening with most hospitals. And then I got placed at Jubilee Hospital. If you are placed there, please swap. Please find a way, defer your internship. Like, that hospital is actually quite dangerous for you as an intern. You want to be in a place where, well, depending on your needs and wants, if you want to learn and actually stay in clinical medicine, you want like a place where you get good supervision with actual academic medicine, and not just, we're just doing our best. So I got placed in Jubilee, called my dad. He was like, nah, I don't know that place, find somewhere else. So luckily one of my friends wasn't doing his internship, so I swapped out with him to Emantateni in Newcastle. My parents were like, it's fine. It's better than nothing. And then eventually I managed to swap to Pulusong because there's actually a lot of UCT grads there. Yeah, because a lot of us were just kind of dumped there. And then we were like I remember WhatsApping my one friend. I was like, oh, girl, like we're all at Pulusong, let's go. And then that's when I settled on Pulusong.
Another question here from Tiro. They said, why did you choose to live in Boksburg? Is there suitable accommodation around the area aside from DQ?
So I chose Boksburg because, once again, my wife. It's sort of midway between our jobs. So she's 30 minutes out, I'm 30 minutes out. Okay. So that's the only reason, really. But Boksburg it's really nice. It's a great apartment. Should I show people?
Getting the tour. We're getting the tour. This is going on YouTube, by the way.
Apartment. Yeah, there's a lot of apartment blocks that you can stay in. There's also closer apartments like near Pulusong, maybe like 20 minutes out. I don't remember the names, but definitely there's some nice places around. But yeah, the reason was just for practicality.
Okay, cool. And I think the rest of that question, there are areas around other than DQ.
Okay. Yeah, definitely. Great. Definitely. Look, I think the closest is 20 minutes, and then the further you go, it's like pretty far.
Cool. And then Robin asks, if people were to apply to Pulusong, what is the likelihood of getting in like a Barrow?
I don't know. Like, so I think it's quite high because the one person that did apply in our intern group got it, and most of us were just kind of dumped there. But I definitely would suggest, if you want like good clinical teaching, enough supervision with not like overworked or overburdened, like Pulusong is actually a great place. Whether you'll get it or not, I'm not sure like how popular it is now or how it will be after this Zoom chat, but it's pretty peripheral. If you do apply, I think you will get it. Look, there's still some politics and stuff around it, but as an internship experience, I definitely would recommend.
Okay, cool.
Yeah.
There doesn't seem to be any other questions here, although there was a question earlier in YouTube that I didn't have the time to get to, and maybe I can address it to everyone here. Ali, actually, I think he's here. I think he's in the chat now. Is he here? Because then he can ask it himself if he wants to unmute. But essentially, he said, what are the skills I think that... Oh, he isn't here. Okay. But essentially, what are the skills that you need to know from 6th year to help you in internship? Like, were there any key things? Oh, he is here. He is here.
From 6th year?
Or, I think I might have butchered his question.
There is nothing... There is nothing academic, and I say this in air quotes, like there's nothing academic that's going to help you when you're thrown in the deep end, right?
Okay.
Obviously, it will help you because you'll have some background knowledge, but like when you're thrown in the deep end, it's either sink or swim. So I think the one thing or the principle that will help you from being a student to being a doctor is just that striving for excellence. Like, for me, it's not about what you know, how many chest drains you can put up, or like whether you know how to do it or not. You will learn everything on the job. And for example, in Pulusong, like there's a lot of stuff like I know, like diabetes, but you still ask and you still learn, and there's so much more to learn. So I don't think like you can study for internship. The only thing is that you have to go into internship with like certain principles. And my principles were that I need to learn as much as I can so that wherever I'm placed for conserve, I can handle it. And the other thing is that always strive to be the best, not in terms of like outdo your colleagues or whatever, but like when you're in a peripheral hospital like this, like I said, you take everything with a pinch of salt. So you need to make sure that you know like the correct medical management for this and this. Like you're not necessarily up to date, but like you're reading the latest guidelines, and you know, like you're being a safe doctor. So the two things, or like strive to be the best doctor you can be, and then just what did I say? I can't remember. But yeah, it's more principles than actual knowledge.
Okay, awesome.
Yeah.
Thank you so much, Gauta. That's so brilliant. It's so fantastic to hear from everyone tonight. I don't know if there's any other questions. If you do have a question, please unmute yourself and ask. Okay, Kira wrote in chat here. But otherwise, thank you so much, everyone, for attending. I'm sorry about to the people in YouTube who watch this later about the power cuts and whatnot. But I would just like to thank our 4 doctors once more for giving up their time during such a hectic period. You know, who would have thought a global pandemic would hit during all of your internships? But thank you so much. We really appreciate it. To Kira, Amy, Gauta, Raf, I'm going to give you a clapping reaction. Thank you so much. And we hope you have a great evening.